Your Excellency, the First Lady, on behalf of the Ministry, allow me once more to appreciate the visiting delegations and the organizers of this conference, including the AU. But let me take this opportunity to thank you, our First Lady, for making time to grace this important occasion. I want to recognize that tremendous achievement and progress has been made by the African countries who have demonstrated that it's possible to reverse maternal and child deaths. However, much more needs to be done to achieve the SDG goals. The theme of the conference calls upon all of us to maintain the momentum and focus towards ending preventable maternal and child deaths by the year 2030, a sustainable path towards African transformation. In the last decades, my colleagues who spoke ahead of me, including Sid and just now demonstrated by Governor Kuti, indicate that we as a country have made remarkable gains in this space. The same story can be told across the continent. However, this belies significant regional differences in Kenya, but also in the other African countries. For instance, in Kenya, Turkana, Isiolo, Garissa, Kisumu counties have recorded higher institutional maternal mortality of over 200 per 100,000 deliveries, while conversely, 2 counties, just to cite Elgeyo Marakwet and Nyamira, have better institutional maternal mortality ratio of less than 50 deliveries per 100,000 deliveries. Basic vaccination stands at 36%, coverage in West Pokot and Mandera on the one hand. On the other hand, in Nyamira, Nandi, Kiambu, Kirinyaga, and Tharaka Nithi, we record over 95%. I'm sure this story can be told from other African countries with very, very deep discrepancies and variations across the countries. The government of Kenya, however, has prioritized women, children, and adolescents' health in her national development plans, as evidenced by increased resources and accountability. Our First Lady, besides being the CS for Health, I speak on behalf of Mothers of Kenya. We, as Mothers of Kenya, have been deeply inspired by both your leadership and that of His Excellency, the President, who are our greatest champions of maternal and child health. In June the year 2013, His Excellency President Uhuru Kenyatta directed the removal of user fees for maternity services in all public facilities, boldly committing government resources to improve maternal, newborn, and child health with free maternity services across the country. This gave us an increase of over 100% in the number of women giving birth in health facilities, demonstrating that eliminating financial barriers greatly improves access to health for women and vulnerable populations. I therefore wish to take this opportunity to urge county governments, through you, Governor Kuti, to continue focusing and investing in maternal and child health interventions. In your little speech, you just committed to that. Your Excellency, maternal and child health services in Kenya have also been augmented by the now world-famed Beyond Zero initiative that you continue to lead. The Beyond Zero program has equipped each of the 47 counties with at least one mobile clinic in an effort to ensure that no mother dies while giving birth. The reason we have about 30 spouses of governors from across the county is because they stand as the champions in the various counties to ensure that this, your initiative, continues to give service that you first envisioned when you crafted this initiative. The government of Kenya has further committed to health for all as one of our big 4 priority development agenda led by His Excellency the President by the year 2022. The ambitious rollout of UHC is a great stride in placing women and children at the forefront of Kenya's development agenda. It is envisaged that UHC will extend maternal health services to cover the 1.3 million pregnant women currently not covered by any medical insurance. I am convinced that the entire leadership across Africa is equally committed and has heavily invested in the health of its mothers and its children. Despite these investments that continue to be made, we continue to face challenges, mainly the geographic barriers to health services, as well as equality of care. The underlying causes of maternal and child deaths are preventable. They are well known. It is therefore upon us all to address these factors. We need to intensify efforts to keep girls in school and, in the short term, diminish HIV, syphilis, polio, and other diseases that continue to take a toll on mothers and our children. Hence, this conference coming at this time, I wish to urge you to propose innovative strategies that will assist countries in the continent and beyond to reduce maternal and child morbidity and mortality. I therefore urge the stakeholders present here today to share best practice from your various countries and sectors. I urge all of us to share, as we share these best practices, to also formulate evidence-based high-impact interventions for maximum health benefits. Beyond this conference, Africa's grand march towards optimal maternal and child health should enter the home stretch as we ready ourselves to launch into the realms of the UHC by the year 2030, and for Kenya more ambitious by the year 2022. As I conclude, let me thank AUC and the local organizing committee for working diligently to ensure a successful conference. I wish to our international delegates a memorable stay in our beautiful country, and invite you to find time away from the conference to also enjoy the scenic beauty of our country. And if you should miss it because of a busy schedule, make time to pass through the only park in the city of Nairobi on your way to the airport. It is now my joy, ladies and gentlemen, to request us to be upstanding and to have our First Lady,